Hey friends, Chris Ardonius here, Dr. Physical Therapy and owner of Functional Flow Pilates, showing you 3 exercises that you can do at home to improve your hip internal rotation necessary for that super deep squat. All right, so we're gonna get into a 90-90. If you've worked with me before, seen my videos, you'll know it's one of my favorite moves here, very effective, very efficient. If you find yourself unable to be upright, grab a hold of 2 pillows or some yoga blocks, place them underneath your butt. If your spine is trying to compensate and hold you up, I promise you can't dial in on your hips. So here you are, you're trying to get this back leg further, and then just staying here and breathing here. So this is going to be exercise 1. You want to improve that hip internal rotation by giving yourself a little bit of that posterior tilt, getting into that posterior capsule. 2 ways that you might feel the stretch can be across that front thigh. You want to avoid any knee tension, and or into your groin and that hip capsule. What I would like for you to avoid is any discomfort or additional pressure on the backside. Might be a sign that your SI joint and sacrum is taking on too much load. All right, so 3 to 5 rocks here, increasing that posterior tilt and then further deepening into that hip internal rotation. As your hip bone is trying to drive down into the floor, you can start to add a little bit load into that hip. You can add a little bit rotation into that hip, right? There's so many ways that you can continue to progress yourself deeper into this passive hip internal rotation stretch. Next up, you will use a band or a belt, something that will just assist you into lifting off into a deeper hip internal rotation. So what I do recommend is closing in that 90 of that front leg, foot to thigh, and then go ahead and bringing your hands down, your chest down. What those will do is slack that back leg. Let's go here. Okay, so this strap will assist to begin, assisting into that internal rotation, just so your brain can have a feeling of what it is. And then when you're ready, you can start to use your muscles to further help. So it's an active assistive effort here. Muscles around into that back side body. What will pretty much happen in the beginning is like we start to just collapse into our side and try to use our spine. I really want you to be strict about that pelvis, embrace your core, keep it at the hip. Once you're starting to assist yourself and working in coordination with your strap, maybe you can let yourself hold that strap up there with your hand, but then try to get your foot to come off the band. So allowing this active work at end range. Inhale, exhale. After about 3 to 5 pulses, I'm going to have you practice working on your isometric holds and breathe. 3 to 5 seconds here in this isometric hold and back off. About 3 to 5 times. So 3 to 5, great way to give you some time to explore. Where do you feel it? How do you feel it? Can you engage? Can you lift off? Hip mobility is all about learning about you, where you are. And I found to be highly effective in helping myself and all my patients to get into their deepest squats. Ooh, should feel that side pocket booty burn. Final time. So I always use my breath to really get me through that tough stuff. All right, exercise 3. Nice, comfortable stretch here, but still pretty intense, especially if you have tight inner thighs. We're going to do an inner thigh plus a hip internal rotation stretch in a W sit or a wide-legged child's pose. So you're going to start off with your hands and knees squared and your feet out. So you can progress as needed. If you can sit back all the way and that feels fine, you can then further advance going wider with your knees, but still keeping your feet wider than your knees. So feet wider, knees can go wider based on your personal preference. Sit back. At some point, if you widen out enough, you necessarily can't go down all the way, and that's fine. You're giving yourself this double hip internal rotation stretch. You can relax your head and chest if that's available. Breathe here. Try to melt into those hips, maintaining that W. I could feel my left one collapse. And then 30 seconds of just breathing, 30 seconds to a minute. Kind of see what your body needs without forcing it, maybe slightly coming out and going back in. And then you can continue on just to your comfort level. And then check on your hips is my favorite. Just sitting into your hips, maybe slightly externally rotate if that feels good for you. Press those knees out, see how those feel, getting deep into those hip capsules. Over time, we want to reduce the external rotation. This will really challenge your hips, your knees, and your feet, and sitting into our dip squat as parallel as possible. So hopefully you enjoyed this video. It's very informative. It is broad and doesn't necessarily apply to every single one because everyone has different varying hip anatomy in regards to angles. So if you find yourself feeling uncomfortable and unsure, always work with a physical therapist. I'm here for you and anyone locally near you. Take care.